myself Sanjay Kumar Yadav, Associate Professor from IIMT College of Pharmacy, Greater Noida. Today we are going to start a very interesting topic, that is electrolytes. So first we will go introductory part about electrolytes. So where we can understand the simple things of electrolytes in our system is either is a very useful to maintain osmoticity inside the system, like intracellular or extracellular electrolytes. So likewise we can go through first slide, that is our objective. First we go through electrolytes, functions, and electrolyte imbalance. So in that we should to know electrolytes. So where different electrolytes are in the form of cations and anions, and their functions, that is electrolytes, we are going to study. Here you can see electrolytes, and second, where electrolyte imbalance, if happen, then what will go for assume or manifestation, or you can say symptom can create. So in that you can see in the next slide, in our body most of the chemical exists in two forms, that is inorganic and second one organic. So where inorganic contains, that is water molecules, salt, acids, and bases. So these are the few inorganic contains in our body system, and where body water contains dissolved mineral salt. So where that dissociate solution, where cations and anions are present in the form of cations, that is in a positively charged, and anions in a negatively charged. So likewise go through next slide. In body fluid, electrically neutral, some of cations based by some of anions, like you can say balanced by potassium, sodium, potassium ion, and sodium ion imbalance. So in that we can simply can understand with the ions, where potassium as well as sodium, they are same charge particles. So okay, before we go through, just you can understand the osmotically active substances, that is glucose, urea, phospholipids, cholesterol. They all are required for a body fluid. They were electrically neutral, can be very useful things in our fluid. So where we are talking about water, that is 70% of water in our body fluid, we have already mentioned. So where you can say intracellular water, that is inside the cell, and extracellular water, that is within the interstitial fluid. Interstitial fluid, you can just here you can see surroundings cells, that is a blood plasma as well as a lymph, where you can say extracellular water, where I have a concept like rule of thirds. So what is the rule of third? So here a rule of third is simply water, they are present in your body fluid. So where 2/3 part of body weight, that is water, and 2/3 of water is within the cell, that is intracellular, and 1/3 of water is extracellular in tissue surroundings, that is interstitial fluid. Already informed you, like surrounding cell, like blood plasma and lymph, they have. So likewise in adult female, 10% lower than male, due to higher fat compared to male in female, and they are likely to more fat, so 10% lower water than male. So likewise, we are to another with the flow chart. You can better understand body fluid compartment. So our body fluid compartment, they are divided into three parts. That is, or divided into two major parts, where interstitial fluid, vascular fluid, that comes under extracellular fluid, where intracellular fluid is the separate one, where fluid present inside the cell only. So where you can go through this statement, so better you can understand with the flow charts, diagram, and different examples. So you can simply check out, and you can prepare likewise. So where interstitial fluid, already talking about, like sodium and chloride, they are present in extracellular, here already mentioned, and intracellular fluid, where the potassium, phosphate, they are present intracellularly. So likewise, we can go through with this simple examples, where major positive ions, they are sodium ions, potassium ions, calcium ions. They have different charge ions, and major negative ions, that is chloride ions, bicarbonate ions, phosphate ions, likewise sulfate ions. So these are the few electrolytes. They are present in your body fluid, either inside the cell or outside the cell. Inside the cell, or, as usual, we are discussed like intracellularly, and outside the cell, we can already inform you like interstitial fluid. So in that you can understand. And what is the why we are just saying intracellularly and extracellularly? Because behind this, we have a simple concept like passive process and active process, where our electrolytes, they are simply exchange with equilibrium, like sodium potassium exchange, chloride, sodium action. Likewise, here already here mentioned, like active process means we can go through sodium potassium pump. So where sodium starts entering into the cell, and then potassium start outside the cell. So likewise, we are going through to major different concept like depolarization, and next slide you can go through repolarization. So where a main concept, why we are study about electrolytes, so we are just simply talking about action potential. So what is the action potential? Simple, we are going to define. So you can just check out, it helps to conduct nerve impulses. Nerve impulses, as you know all well, nerve impulses from brain to different part of the body. So where which is a basis for all physiological and biological process of the body. This process, that is this process, going to say, that is known as a action potential. So where we have two process, that is depolarization. We are talking about contraction, and repolarization, that is relaxation. So depolarization, you can see the extracellularly, and whatever be electrolytes, they are rich in extracellularly, which diffuse, that means starts entering into the cell, that is sodium concentration. They are present in outside the cell, then starts entering into the cell. This process is known as depolarization. And secondly, go through likewise repolarization. Repolarization, that is relaxation, or you can say simply relax in the cell sense. You can say sodium channels are closed in this process. and potassium channels are open. So here potassium concentration is more in cytoplasm. So this leads to change of membrane potential to negative, that is called as repolarization. So after a resting stage means you can simply see, or you can say simply it is the pause stage, and after that starts again this process like depolarization, repolarization. So in this process you can simply say contraction, relaxation again starts till life or till cell or tissue alive. This process going on. So in this process you can simply say depolarization and repolarization. Here, next process. What do electrolytes do? That means in our body fluid, what is the role of electrolytes? Why we are studying? Why we are discuss about electrolytes like intracellularly, extracellularly? So in this we are just simply try to concept be clear with the help of this simple image, and here you can just see these electrolytes promote neuromuscular impulses, maintain body fluid, distribute body water between fluid compartments, and regulate acid-base balance. So these are the few major roles of electrolyte in our body fluid system. So where electrolyte imbalance. Suppose we are going to discuss electrolyte imbalance. Electrolyte imbalance means deficiency of electrolytes if persists or if occurs in our body fluid due to any reasons like insufficient dietary intake or insufficient that is in the form of food, fruit, unable to just maintain body fluid electrolytes. So we are under electrolyte imbalance. So in that different electrolyte imbalance, suppose we are going to like sodium ion deficiency occurs, then we are very risk about hyponatremia, and excess sodium electrolytes they are present in body fluid, that is hypernatremia. Likewise, potassium suppose is going to less, that is hypokalemia. Increased potassium electrolyte in body fluid, that is hyperkalemia. Likewise, again magnesium suppose less present in the body fluid than hypomagnesium, magnesemia, like increases or excess magnesium present in body fluid, that is hypermagnesemia. Likewise, hypercalcemia, hypocalcemia, and hypophosphatemia, hyperphosphatemia. So likewise, different diseases, different deficiency or imbalance, they occurs in our body fluid. Suppose apart from these, like sodium, potassium, magnesium, calcium, chloride, phosphate, apart from these any electrolytes, they are going to decrease or increase in our body fluids. They may lead this type of problems, where we can the help of different diagrams. So we can go through this diagram, that is like this one. You can see simply, suppose hypo hypokalemia. So in this process, simply in this process can see headache can occur. Suppose sodium ions, sodium electrolytes, they are very less or compared to normal, they can unable to maintain. So this type of headache, like a dry coated tongue, like poor skin, sugar, then headache, nausea, and vomiting can lead if sodium ion is less compared to normal. So likewise, twitching, mental status, irritability, likewise. So different, you can simply see this with the help of fatigue, matlab full tired, likewise vomiting can occur. So this one. And then hypernatremia means again increased to sodium and in body fluids. So in this we can with the help of images or the diagram. So here you can see, suppose sodium ion in excess your body fluid, then we can feel like skin flushed, excessive thirst. We can feel frequently thirst, means required body required excess water any time. So fever can occur, thirst, agitation, skin flush. Matter. Likewise, hypokalemia, that is potassium. Suppose potassium less compared to a normal potassium, they are present in your blood body fluid. So we can simply say this type of problem, that is we are going to just made a simple term, that is suction. So you can simply can learn, can study. So what is the SUCTION, like that. So in that, what is the S, that is skeletal muscle weakness, U, that is wave ECG changes, or you can say arrhythmia, improper impulses can generate constipation, likewise tone, irregular, weak pulse, orthostatic hypotension can occur, numbness, that is paresthesia can occur. So likewise you can with the help of this image, you can simply see this person that is going affected with potassium deficiency. So they can feel like alkalosis, shallow respirations. They may occur irritability, confusion, drowsiness, weakness, fatigue. So likewise, this type of problem can occur in these all the persons. So go for likewise hyperkalemia. So hyperkalemia, that means I know hyper, that means excess. So excess potassium means irritability, paresthesia, muscle weakness, likewise. So in this way, you can go through with the help of again images. So this is very useful. So you can go through and you can imagine, you can write, you can able to make a sentence under this. So you can just see this problems, twitching, cramps, paresthesia, irritability, anxiety, hypotension. The hypotension, that is blood pressure decreases. So likewise, problem can. Uh, so in that, calcium, one more electrolytes is there. Suppose calcium is less in our system. So before we are going to just discuss, you can just simply see in our PPT, calcium, that is 99% in our bones and 1% in our system and soft tissues. So you can imagine how much calcium required in our body fluids or in our system to maintain calcium. So in that, suppose calcium is going down or calcium going less compared to others. So in that, we can say fracture can occur, diarrhea can increase, yes, anxiety, confusions, irritability, muscle twitching. So you can just see with the help of this diagram where Trosius sign, that is bend your simple hand or abnormal or simply compared to a normal person, this is the bend condition. So here you can see this type of signs can occur. So this different diseases can occur. So we are going through hypercalcemia. Hyper means increased. So increases the calcium in our body fluids. So in that, this type of like fatigue, confusion, coma, muscle weakness. So likewise, this type of problem can occur. And why we are just saying hypercalcemia? Because of cancer or hyperparathyroidism can lead calcium in our body fluid. So in that you can see with the help of diagram here, constipation, nausea, vomiting, they are the major symptom can occur if calcium increases in our body fluid. Where you can see another pictures is there, images you can see here. So different calcium, suppose calcium excess in our, so you can simply see this is calcium stone is there, calcium precipitation is there. So in that case, stone can occur. So in this way, you can see calcium excess in our system can type of problem. So likewise, go through one more electrolyte, that is magnesium. So magnesium, that is a very important role of as an electrolyte. Here you can see that is cofactor for many enzymes, that is adenosine triphosphate, that is ATP utilization in muscle fibers, then a role in protein synthesis, carbohydrate metabolism, then it is very useful for vasodilation in cardiovascular system, and next is regulate muscle contraction. So it is a very important electrolyte. They are present in body fluids. So you can go through. Suppose magnesium going down in your body fluids, then due to the different reason, dietary intake or poor GI absorption, likewise. So excessive. So in that case, mm, malabsorption, GI urinary system disturbance, sepsis can occur. So likewise, this problem can lead for the action. So you can here see clinical manifestations of hypomagnesemia. So clinical magnesium. So you can simple see magnesium deficiency can lead first confusion with this diagram you can see, and go for the cramp, hmm, convulsion, and depression. So as you know, what is the confusion? Okay, it's simply whatever we learn, or you can remember things always be confused state because magnesium deficiency in your body fluid. So in that, cramp can occur in your you can simply just see with this pictures can understand the efficiency of magnesium, what happened actually, and then go for convulsion. So convulsion means that is fits, or you can say simply sudden response to the brain is goes down. So, then hypermagnesemia in the serum magnesium levels not common. Renal dysfunction is most common cause. Renal failure can occur. Addiction disease may lead. So in this way we can say these all electrolytes and different electrolytes they are present in our body fluids can make a very useful role and important thing. So in this way, thank you to all, and we will discuss. Suppose any doubt, any confusion, you have any query, any questions related to this topic, so we can always available. So thank you to all.